Currently, TAVR is approved in United States for patients who are considered inoperable risk, high risk, or intermediate risk for open heart surgery. Determining the risk involves a lot of different factors. You have to take into account what is called an STS score. It stands for Society of Thoracic Surgeons. There's a score model that we kind of input patient characteristics, and it tells us what is the risk of the patient dying during open heart surgery, and what are the other morbidities, being on a ventilator for a longer time, or having renal failure, or having a risk of stroke. So if anyone has a STS score of 3% or above, TAVR is an approved indication for those set of patients. The other aspect of that, besides calculating their STS score, is frailty. STS takes into account a lot of things, but it doesn't take into account everything. So you could have someone whose STS may look like maybe 2.5, but when you see the patient and they appear frail, they may have certain other factors or comorbid conditions that are not accounted for in the STS score. So we can offer those patients as well.